Delirium is an abrupt decline in mental function, including memory, orientation, perception, behavior, language, and personality, which can fluctuate from day to day and can last for hours, days, or weeks. In contrast, dementia has a gradual onset, lasts for months to years, and progressively worsens over time. Okay. Now, delirium usually occurs as a consequence of an underlying condition. Health problems like heart failure, cognitive impairment, or visual and hearing impairment can make patients more vulnerable to the impact of stress, pain, sleep deprivation, immobility, dehydration, or malnutrition, which can lead to delirium. Other risk factors include advanced age, infections, and electrolyte imbalances, as well as being hospitalized, being in intensive care, the use of mechanical ventilation, and sensory deprivation. Some medications, such as benzodiazepines, opioids, and anticholinergics, can also contribute to delirium. Notably, dementia is a leading risk factor for delirium, and delirium increases the risk of developing dementia. Now, although the exact cause of delirium is unclear, it's likely not due to a single factor. One theory is that impaired oxidative metabolism can lead to low oxygen levels in the brain. Another theory is that abnormal levels of neurotransmitters in the brain, like decreased acetylcholine, increased dopamine, and either increased or decreased serotonin, can promote the development of delirium. It is also thought that in delirium, neuronal membranes may not be able to depolarize properly, and therefore the action potential cannot be efficiently transmitted from one neuron to another. Alternatively, delirium might be related to inflammatory cytokines that are released during infection or trauma, which interfere with neuronal function. Okay. So clinical manifestations include disorientation, meaning the patient doesn't know where they are or what day it is, or they might have difficulty concentrating. Based on the level of activity, delirium can be classified as hypoactive, hyperactive, or mixed, where their activity fluctuates. The patient's emotional state can also range from being irritable and agitated to being withdrawn and depressed. Their speech might be rambling and hard to understand, and they could experience hallucinations, which means they see, hear, or even smell things that are not actually real but feel very real to them. Alright, now the diagnosis of delirium is typically based on the patient's history, as well as a physical and psychological assessment. In addition, certain tools like the Confusion Assessment Method, or CAM, can be used to assess delirium. Now, after the diagnosis is confirmed, the specific cause can be identified based on laboratory tests and imaging tests, like CT and MRI scans. Moving on to treatment, delirium is a medical emergency that must be recognized and treated promptly. The good news is that delirium is often reversible when the underlying condition is resolved. Okay. When caring for a patient with delirium, your primary responsibilities include prevention, early recognition, and working with the healthcare team to identify and treat the underlying cause. Begin by recognizing when your patient is at risk for delirium, such as elderly patients, patients who are immobile, or those who have underlying health conditions like dementia or sensory impairment. Review their medications to identify any that could potentially contribute to delirium, and collaborate with the healthcare provider and pharmacist to consider possible alternative medications or changes in dosage. Also take steps to keep your patient's pain managed with pharmacological and non-pharmacological interventions. Also be sure to check for the presence of hypoxia and initiate supplemental oxygen as needed. Then, ensure your patient is well hydrated, check their laboratory test results to identify fluid or electrolyte imbalances, and administer the prescribed IV fluids as needed. Also, be sure to assess your patient's nutritional status and collaborate with the dietitian to ensure your patient is receiving adequate calories and nutrients. Promote mobility by working with the physical therapist to provide range of motion exercises and assist with mobility. You'll also want to ensure your patient has adequate rest and sleep, so be sure to cluster your nursing care and reduce noise and distractions to allow for periods of rest. If your patient uses sensory aids, such as hearing aids or glasses, be sure they are wearing them to prevent sensory deprivation, and be sure to encourage social interaction with family or friends to prevent feelings of isolation. Finally, during care, promote your patient's orientation to their surroundings by using clocks and calendars to provide cues to date and time, place familiar items and photos in your patient's room, and reorient them often. Speak to them in a calm, reassuring tone, and provide simple explanations about the nursing care you're providing. Alright, as a quick recap, delirium is an abrupt decline in mental function, including memory, orientation, perception, behavior, language, and personality, which can fluctuate from day to day and can last for hours, days, or weeks. In contrast, dementia has a gradual onset, lasts months to years, and progressively worsens over time. Delirium usually occurs as a consequence of an underlying condition. It's characterized by disorientation, hallucinations, and altered activity and emotional state. Nursing considerations are focused on prevention, early recognition, and working with the healthcare team to identify and treat the underlying cause.